In 2016 alone, 785 Hoosiers died due to an opioid overdose. The opioid epidemic is only getting worse, and it is up to us as a community and a state to stop it. According to the doctors at the National Institute of Drug Abuse, roughly 30% of patients prescribed opioids for chronic pain misuse and abuse these drugs.
Striking without warning. On a public bus outside of Philadelphia. On a street in Detroit.
They got needles on their legs.
Come on. Opioids pushing thousands of Americans to the brink of death, playing out on social media. People having to be revived, even by their own children. And the heartbreaking results.
He died right here, right upstairs.
He went to his room and he overdosed. And Kevin didn't know. You know, he had gone to bed. And he got up in the morning and went to work.
I actually left work early that day. And, I'm kind of getting things ready for dinner. And I hear a noise.
Heard the dog scratching in the room. His dog. It went upstairs.
As I'm walking up the stairs, the whining's continuing. I open the door, and there was Dave.
There are a variety of addiction treatments and facilities available for use throughout the state of Indiana, such as the Indianapolis Comprehensive Treatment Center, the Substance Abuse and Mental Health Services Administration, and the Indiana Addiction Hotline. But a large amount of people that need help with their drug addiction never seek or receive this help. Nationally, our governors and senators are pressing for more help to fight the opioid epidemic by issuing a public health crisis in 2017 and by establishing new rules for prescribed opioids. The government should not only keep these establishments throughout our society, but they should enforce them. Making it harder to get opioids will help the epidemic, but the government should also conduct research in relation to new medications that treat pain but have a low risk of addiction and abuse. Private industries should refrain from giving opioid medications to just anyone, and they should increase their advertisement and begin to sell safer, less risky drugs that are alternatives to opioids. If we work together, we could stop this horrible epidemic.
Millions of families struggle to get insurance coverage for addiction treatments. And those same families, in the time of crisis, are uncertain of the rights and coverage which are available to them. By law, the Mental Health Parity and Addiction Equity Act requires your health plan to apply equal coverage to mental health and substance use, as they do for other medical and surgical benefits.
However, this act is not enforced. We should keep this act issued by our state, but improve it by diligently enforcing it and making it known to the public. Visit www.thepetitionsite.com/takeaction to sign the petition to demand insurance to cover all addiction treatments. We can help families around the world. Remember, when abusing opioids, you are not only hurting yourself, but you are hurting your loved ones. Stop the opioid epidemic today.